Hello, I'm Michelle Frizzell, Chief of the Bureau of Nutrition Services at the Ohio Department of Health. Welcome to the Alcohol Screening and Brief Intervention Training. Those of us working with mothers and children recognize that decreasing alcohol-exposed pregnancies is vital to the overall health and well-being of future generations. In WIC clinics alone, 5% of pregnant women report alcohol use during their pregnancy. Unreported use could well be significantly higher, but even one woman who is using is one too many. This training is being provided to educate WIC clinic staff on how to provide brief intervention sessions to pregnant women using alcohol. The goal is to help them understand the dangers of drinking during pregnancy and to set goals for reducing their drinking, or better yet, stopping it altogether. Thank you for your dedication to the participants and your continued service to the Ohio WIC program.
My name is Susan Caperna, and I have 4 children. We have 3 daughters who are biological and a son that we adopted through Montgomery County foster care. Cole came to us when he was about 6 months old as a foster child, and we adopted him when he was not quite 3 years old. And prior to adoption, when he was probably about 18 months old, our caseworker said to us, "You need to get this child assessed," because he sensed that there was something that was not quite right with him. So we began looking for answers and trying to find out exactly what was going on with him from the time he was 18 months old. He was a very volatile child. He would have anger outbursts where he would flip my chairs. He would get up in the morning and he would cry uncontrollably for no reason. So we were just seeing a lot of behaviors that were not really typical for your 18-month to 2-year-old child. So we really wanted to find out what was going on with him. So we began the process of seeing doctors and received different diagnoses. Of course, ADHD because he was so busy. The possibility of bipolar because there was bipolar in his family, and reactive attachment disorder. We started therapy with a reactive attachment disorder therapist who actually was the person who continued pressing me on looking for answers, because she would say, you know, he does things that children with reactive attachment disorder do, but he's not really quite reactive attachment. So it was when he was about 8 years old, we had visited actually 2 doctors who finally diagnosed him. And what kind of preempted us going to see, and they were specialists, he was struggling in school. He was not learning. He couldn't read. He wasn't even really learning his alphabet. The school was very concerned. He started school when he was 3 years old on an IEP for social emotional disorder. And so he had been in the system. When he got to kindergarten, they were like really concerned because he was academically behind. So by the time we got to 1st grade, you know, we knew that there were problems academically. So we went to see a neuropsychologist for academic testing, and he is one of the doctors who diagnosed him. And we also went to see a doctor who specialized in bipolar, and he also confirmed that he was not bipolar, that he believed he was in the fetal alcohol spectrum. So both of those 2 specialists are the ones. So it wasn't until he was 8 that we really even knew what was going on with him, with all the learning challenges, with all the behaviors that we were encountering. He had been on medication for a mood disorder from the time he was 3, so we were already seeing a psychiatrist from the time he was 3. So a lot of legwork trying to figure out what was going on with him and to try and help him. So at age 8, when we received this diagnosis, I went home and cried for 3 days, and then I got on the computer and I started educating myself with what ARND is, which is what he had been diagnosed with, which is alcohol-related neurodevelopmental disorder. He did not have the typical facial features that are associated with a child who is fetal alcohol syndrome. So that's probably why he went undiagnosed for so long. He looks very typical. If you were to see him, you would not really suspect that there was anything wrong with him, but he has all the cognitive disabilities associated with the brain damage. So from the time he was 8, I was educating myself, learning what was going on with him, and what I discovered is there really were not a lot of services out there for him, that a lot of people didn't even really know much about fetal alcohol spectrum disorders. After I educated myself, his therapist told me that I probably knew more than she did because she specialized in reactive attachment disorder. She didn't know much about fetal alcohol, although she was the one who kept saying there's something more. And after the diagnosis, she goes, well, now the pieces fit. Now we know why the therapies weren't helping him to go past a certain point, why he wasn't responding, because he couldn't respond because of the cognitive disabilities. So I now have a 14-year-old, he's 14 now, and we've been through quite a few challenges with him. School has been a very difficult time for him. We pulled him out after kindergarten and put him in, well, actually I homeschooled him for a year because he was having such mood issues, and then we put him in a special school for a year, and that was the year that he got diagnosed. So then I went back to my public school system where he is currently receiving services, and that has been a very difficult journey. We had to take him out of school for a year and a half because of his behavior at school. We couldn't keep him in a school setting. We had to do in-home tutoring for him. So we've been down quite a lengthy road with him with the challenges that he has. It's a very sad disorder because he's a wonderful young man. He's, in some ways, if you were to meet him and talk to him, you would never know he had a disability until you spent a lot of time with him, because he has very high verbal skills, but cognitively he reads at maybe a second grade level. He really can't do math. We're not looking at a child who at age 18 is going to be able to emancipate. He's not going to be able to live on his own. He has a lifetime disability. And so we're at age 14 and have a lot of challenges ahead of us. This is 100% preventable if birth mom does not drink while she is pregnant. And that is really the key. Unlike some disorders like autism that we really don't know what causes it at this point in time, we know what causes fetal alcohol spectrum disorders, and the only thing that can cause it is if birth mom drinks while she's pregnant. I think it's a message that a lot of women don't get. Women like my son's birth mom, she had alcohol and drug addiction problems, so that's a whole different thing than just a person who's drinking a glass of wine with their dinner. But I think because we don't know how much is too much, we want to continue to promote that message of, let's have a healthy pregnancy, let's not drink while we're pregnant. If we're going to get pregnant, let's not drink, when we could possibly be pregnant, not knowing. And that's a message that I don't think enough moms get. I guess in my heart, I believe that most women would probably not drink if they knew that it was going to harm their child. I really don't. And if they had to spend a week with my son, they probably would not, because as wonderful of a young man as he is, he's very demanding. He requires the supervision of a 2-year-old. I cannot leave him home alone. He will probably require lifetime supervision and help. We don't know. We're still, we're at 14. We have a ways to go before we even really know what his life is going to look like. As a mother, you do anything for your child. You do anything for your child to help them, and this is not something I can fix. I will never be able to fix. I can put interventions in place for him. I can advocate for him at school. I can educate people in the community to hopefully help them not to have to live with what we're living with, but I can never change the damage that is done to his brain, and he has to live with that for the rest of his life.
My name is Tracy Waller, and I am the supervisor for the Montgomery County WIC program, which includes Dayton, Ohio, and the surrounding suburbs. Our WIC clinic started using the alcohol screening and brief intervention process in 2008 as a part of a study that replicated the success of the model in Los Angeles County, California WIC offices. For 4 years, we followed the model to screen all pregnant women for alcohol use during pregnancy and provided brief intervention and follow-up services to those who screened positive. The intervention was so successful and so easily integrated into our existing WIC flow that we decided to continue the process after the project ended. We feel this evidence-based intervention is too important to our participants' health and community well-being to stop now. We are excited to share the information with you and hope that you too will integrate this successful, cost-effective strategy into your WIC clinics. You are viewing Module 1 of a 4-module series that discusses the alcohol screening and brief intervention process to decrease alcohol-exposed pregnancies. This module will talk about alcohol use in general terms in American society and define both heavy and binge drinking. Module 2 will describe the effects of alcohol on the pregnant woman and her developing fetus. Module 3 will introduce you to the screening and brief intervention process, and Module 4 will guide you to implement this process into your WIC clinic. In Module 1, we will spend our time discussing alcohol in American society and its use in both pregnant and non-pregnant populations. We will also discuss what a standard drink actually is and take a quiz to test your skills at calculating how much alcohol is in commonly served drinks. More than half of Americans older than 12 years report using alcohol in a 2010 survey. And for young adults surveyed, more than 40% reported binge drinking and more than 13% say they were heavy drinkers. When broken down by age group, the binge drinking among 21 to 25-year-olds becomes very apparent. Slightly more than half of Americans aged 12 or older reported being current drinkers of alcohol in the 2010 survey. This translates to an estimated 131 million people, which was similar to the 2009 estimate of over 130 million people. Nearly 1/4 of persons aged 12 or older participated in binge drinking at least once in the 30 days prior to the survey in 2010. This translates to about 58.6 million people. The rate in 2010 was similar to the rate in 2009. In 2010, heavy drinking was reported by 6.7% of the population aged 12 or older, or 16.9 million people. The percentage was similar to the rate of heavy drinking in 2009. The rate of binge drinking in 2010 was about 40.6% for young adults aged 18 to 25. Heavy alcohol use was reported by 13.6% of persons aged 18 to 25. These rates were also very similar to the rates in 2009. Among pregnant women aged 15 to 44, an estimated 10.8% reported current alcohol use, 3.7% reported binge drinking, and 1% reported heavy drinking. These rates were significantly lower than the rates for non-pregnant women in the same age group, which were 54.7%, 24.6%, and 5.4% respectively. Binge drinking during the first trimester of pregnancy was reported by 10.1% of pregnant women aged 15 to 44. All of these estimates by pregnancy status are based on data that was averaged over 2009 and 2010. Binge drinking data from 1993 to 2005 represents all respondents who reported consuming 5 or more drinks on an occasion. Data from 2006 to 2009 represent men who reported consuming 5 or more drinks on an occasion and women who report consuming 4 or more drinks on an occasion during the past 30 days. Heavy drinking data from 1993 to 2000 represent all respondents aged 18 years and older who report an average of 2 or more drinks per day. Data from 2001 to 2009 represent all male respondents aged 18 years and older who report an average of more than 2 drinks per day, and female respondents aged 18 years and older who report an average of more than 1 drink per day. Our focus, of course, is on pregnant women. A look at the numbers shows more than 7% of pregnant women reported drinking alcohol within the last month. According to Ohio PRAM's data, combined for 2009-2010, almost 47% of all pregnancies in the state of Ohio were unintended. 63.1% of WIC mothers reported unintended pregnancies, and only 34% of non-WIC mothers reported unintended pregnancies. Of all of the unintended pregnancies, almost 56% of those were not using contraception, and 60.2% of women drank alcohol in the 3 months prior to their pregnancy. 6.7% drank alcohol in the last 3 months of their pregnancy. The risks of alcohol use in the general population include unintentional injuries, violence, including intimate partner violence and child maltreatment, risky sexual behaviors, and long-term effects including cancers, heart disease, stroke, liver disease, and depression and anxiety. The risks of alcohol use that are unique to females include the increased risk for breast cancer, increased risk for menstrual disorders, increased risk for female infertility, unplanned pregnancy, and prenatal alcohol exposure.
When women drink alcohol while they are pregnant, it causes a range of effects in the growing fetus called FASD, or fetal alcohol spectrum disorders. When the woman drinks while she's pregnant, the alcohol crosses the placenta and it gets to the developing fetus and it damages the brain, it damages the organs. And so we really request that women don't drink the entire 9 months while they're pregnant. Even before women get pregnant, they should stop drinking alcohol. Most women don't realize that they're pregnant when they get pregnant because they aren't trying. CDC data tells us that almost 50% of women get pregnant when they're not trying. And so it's rational to think that most women will continue their normal drinking patterns when they don't realize that they're pregnant. And that's really led to the prevalence of FASD, which is estimated to be 10 per 1,000 births. And that's more prevalent than Down syndrome. And so we would like every woman who's pregnant or trying to get pregnant not to drink alcohol, and not to drink alcohol the entire 9 months of their pregnancy. The effects of prenatal alcohol exposure to the child is very wide-ranging because it can be very, very mild, and it can also be very, very severe. And these are lifelong conditions. So once the baby has these conditions, they have them for the rest of their lives. So that can be anything from facial abnormalities to mental retardation, learning disabilities, problems with eye-hand coordination, problems with social emotional learning, attention deficits, hyperactivity, and the list goes on and on. So many women think that drinking even a little bit of alcohol is okay while they're pregnant. And the reason for that is because there's a host of conflicting messages that they hear in the community. They may hear one thing from their physician, they may hear something different from their mother, they may hear something completely different from their best friend. And what they're hearing is that sometimes it's okay to drink during a certain trimester of their pregnancy. Sometimes they hear that it's okay to drink a certain type of alcohol, and sometimes they hear that it's okay to drink a certain amount of alcohol. And the fact is, we just don't know. The research is completely inconclusive, and every woman's body is unique. They have different genetic and metabolic factors that we don't know what the specific characteristics are between the mother and the baby combination that's going to make some of them at risk for developing an FASD and some of them at a lower risk for developing FASD. And because we don't know, we just would like women not to drink the entire 9 months. Why take the risk? So if you know someone who is drinking during pregnancy, please urge them to stop. Women drink for different reasons. Some of them just don't know. They don't know the damage that they're doing to their babies. And so if you can give them that education and help them to stop, that's going to help for them to have a healthy baby. Other women may drink because they've been hearing these conflicting messages. And we want to acknowledge the fact that we just don't know if it's going to damage their baby or not. And so, just ask them, why do you want to take the risk? Just don't take the risk and make sure you have a healthy baby. Other women drink alcohol because they may have an alcohol abuse disorder. Those women need to get some help, and they need to get some help immediately because the damage that they're doing to their baby is lifelong. And so we really want all women to hear our message, which is not a single drop of alcohol during the entire 9 months of pregnancy, and not to drink alcohol if they're trying to get pregnant.
According to the Dietary Guidelines for Americans, moderate alcohol consumption is defined as having up to 1 drink per day for women and up to 2 drinks per day for men. For men, heavy drinking is typically defined as consuming an average of more than 2 drinks per day, and for women, heavy drinking is typically defined as consuming an average of more than 1 drink per day. According to the National Institute on Alcohol Abuse and Alcoholism, binge drinking is defined as a pattern of alcohol consumption that brings the blood alcohol concentration, or BAC, level to 0.08% or more. This pattern of drinking usually corresponds to 5 or more drinks on a single occasion for men, or 4 or more drinks on a single occasion for women, generally within 2 hours. So what is a standard drink? Any drink that contains 14 grams of pure alcohol is considered a standard drink. There are variations between brands and different types of alcohol containing drinks. However, the following is considered standard: 12 ounces of beer, 5 ounces of table wine, or 1.5 ounces of 80 proof spirits. Other drinks like fortified wine and malt liquor beverages contain varying and higher percentages of alcohol and therefore have smaller serving sizes. Notice the definitions are the same ones you use in assigning risk code 47, alcohol use, for postpartum and breastfeeding women. Also, as you know, any alcohol use during pregnancy, regardless of the amount, is justification to use risk code 47. As you discuss drinking habits with participants, it is important to know how much alcohol they are consuming using these standard sizes. Using the following drink sizes and recipes, determine how many servings of alcohol are in each in the following quiz. How many servings of alcohol do you think are in a 40-ounce malt beverage like Colt 45? There are at least 4 servings of alcohol in a 40-ounce malt beverage. How many servings of alcohol are in a martini? In this standard 7-ounce martini, there are 3.6 standard drinks. How many servings of alcohol are in this 9-ounce pina colada? There are 2 standard drinks in one 9-ounce pina colada. What about an 8-ounce cosmopolitan martini? There are 3.9 servings of alcohol in an 8-ounce Cosmo. How many servings of alcohol are in a 21-ounce light beer? There are about 1.5 standard drinks in one tall light beer. How many servings of alcohol are in a 9-ounce margarita? In just one regular-sized margarita, there are 5.1 standard drinks. If an individual consumes a container of alcohol in a week, their servings of alcohol can add up quickly. A regular bottle of table wine equals 5 standard drinks, while the same size bottle of 80 proof liquor is 17 servings of alcohol. Alcohol content varies greatly by the size and type of drink consumed. A mixed drink or typical serving in a bar restaurant is rarely a standard serving of alcohol. Alcohol consumption is common across most populations in the United States. Heavy drinking and binge drinking are common and relate to many health problems. Alcoholic beverages vary widely in how many standard drinks they contain, and it is possible to have a binge episode with just one glass. Next, Module 2 will provide a discussion about alcohol's effects on pregnancies and an overview of fetal alcohol spectrum disorders.